on me. You can just put your intro in the chat would be great. So thank you all for being here. It is my super pleasure to introduce Dr. Deborah Levy. She's a pediatric rheumatologist at SickKids Hospital in Toronto, as many of you know. Dr. Levy is someone that I consider a friend and is someone who is so committed to our kids. Her title is Clinical Director of the Division of Rheumatology at the Hospital for Sick Children, SickKids in Toronto, and is an Associate Professor of Pediatrics at the University of Toronto. Maybe more interesting than any of that is that she is also a fellow Camp Billowing camper, but she was there quite a few years after me. I was there in 1984 and she was there quite a time after me. She's also, let me tell you some other things about her. She's also a co-director of the Lupus Clinic at SickKids, focusing on long-term psychosocial outcomes of child-onset lupus. And she's doing some really cool work with alternative models of care for children with arthritis, as working with practitioners to develop a new network of pediatric rheumatology providers for children in underserved communities within Ontario. So that's a really cool outreach. She's also quite involved in advocacy, and she's done a lot of things to really help improve access to the drugs for pediatric rheumatology patients. So she's doing some amazing work in that area. Dr. Levy has lived, trained, and worked both in the US and Canada, and is proud to call Toronto home, and it is my pleasure to have her here today. And so many of you already said that she's amazing. So over to you.
Thank you, David. You can hear me okay?
Perfect.
Okay, and I think you can still see my slides?
Perfect.
Perfect. All right, welcome everyone. Now, for those of you who know me or have met me, you know that I could talk about lupus for probably the next like 17 hours, but we only have, a few minutes. So I've tried to distill this down to what I think is, the really important, where do we start? But there could be many conversations after this. I didn't condense this into 20 minutes like I was sort of asked to do. I thought it would be better if you could put questions into the chat or put your hands up, and we'll try to address those questions as we go along. And if I know it's something that's coming up, then I'll say so. I'm going to ask David, though, to watch the chat, though, because I only have 2 screens and not 5, so I can't watch everything. So let's just start. So this is what I thought would be great to try to cover. And again, this is going to be sort of high level, and I obviously can't cover everything, but at least a start. So what is lupus and what does it look like? What treatments are available? What else can I do to stay healthy? And then along the way, some Q&As. So what is lupus? This is the biggest question that we still can't really answer. But the easiest way to answer is to say, well, it's an autoimmune disease. And then, of course, the next question will be, well, what does that mean? And what is an autoimmune disease? So if we think about it sort of in a simple way, we have our guards, and these guards are our immune system. And the immune system is all of the white blood cells in our body, and it's a system that you can't see. Unlike your skin, your hair, your heart, you know where that is. Your immune system is everywhere. And what its goal is to protect you against foreign invaders. So here in the upper right corner, these foreign invaders are infections. And that's the primary role of the immune system, is to protect you against infections. However, in lupus, what happens is, if we go back, when your immune system sees an infection, it revs up and it starts to fight that infection. And it makes you feel crummy and it gives you a fever and you feel achy all over. And that's the job of the immune system. That's when it's working right. In lupus, however, what happens is your immune system sees your own body as that foreign invader and starts to fight it. And obviously, you don't like that. And it can cause all sorts of different kinds of symptoms. So we call lupus the disease of 1,000 faces. Now, I know Dr. Tucker in BC uses this term. I'm not sure if everyone else across the country does, but this is how we think of it. And the reason we call it the disease of 1,000 faces is because everyone who has lupus looks a little different. Not everyone has a rash on their face. Not everyone has their heart or their lungs involved. Not everyone has their kidneys involved. But really, in lupus, any organ system, so any part of your body can be involved. On this picture, you just see here, you see the skin can be involved, the brain. Now I'm going to go into these a little bit more. The lungs, the Really, this is the blood system, the spleen, the joints, that's any part of your body that moves. Oops, sorry. The kidneys, blood tests can be abnormal, and then the blood system as well. So the next question would be, well, why do some people develop lupus and others don't? Why does my immune system not work the same way as other people's? And really, if we think about lupus, it's not one disease, it's 1,000 different kinds of diseases, and that's what I just told you. And so really, there are almost as many reasons why people develop lupus. This is a picture of the DNA in our body, the human genome. And you're born with a gene makeup, right? You can't do anything about that. You can blame your parents for what you got, but that's what you're born with. And you have certain genes, and those genes may predispose you to develop some disease or some illness along the way or through your life. Then along the way, our immune system matures and gets exposed to infections and gets exposed to vaccines. And along the way somewhere, the immune system may get confused, like I said. Hormones have an effect on whether or not you're going to develop lupus. This is a picture of the globe. I don't have a good picture to explain it, but I'll get into it a little bit more. Where you're from in the world and where your families are originally from in the world also affects whether or not you're going to get lupus or you might get lupus. The sun certainly sets off lupus for some people. Those big bad invaders, those foreign things, those infections set off lupus as well. And some of it, though, is this question mark, right? We don't know everything. Obviously, we really don't know everything, but for some people, we really don't know why they've developed lupus. All right, so if we think about, so I live in Ontario, I live in Toronto, and one of the studies I've done is to look at people who are now adults who had lupus that started when they were a child. And I kind of went around the province and I gathered up this big cohort, we call them cohorts, or a big group of people who had lupus as a child, and they still have lupus, but they're now adults. And when we look at that group of people, what you see from this graph is that all ethnicities are represented, but the graph doesn't look like what Ontario looks like. So what you see is that the white population is actually smaller than all the other populations. And so it's not really looking like the province. What does that mean? It means that lupus affects people who are of non-white ethnicities more than people who are white. And we see that around the world too. So there's very large numbers of people in Asia, in East Asia, in China, in Japan, in other Asian countries that have lupus, that people who are of Black ethnicity, so from African communities, but also from Afro-Caribbean and other Black populations, their relative risk for getting lupus is greater than someone who's white. And then, in Canada, we've had a great immigration from South Asia, from India, from Pakistan, and other countries. And we see a lot more lupus in that population as well. This is a different study that we've done. This is looking at lupus across the country. So we know that different cities look different in terms of their ethnic makeup and where immigrants have come from, but we still see across the country that more people of the children that we see with lupus, the minority are those who are white and the majority are those who aren't white. And that tells us that the genetics and the genetics of lupus are different.
It's my turn.
Right? Different in different ethnicities.
No, this over.
I think somebody has their microphone on. So we know that children are not little adults, right? As any pediatrician will say this all the time. So children with lupus aren't exactly the same as adults with lupus. And why is that? There's something in them that made it start when they were a child. So lupus is the same disease when you're a child as it is when you're an adult. But if it starts when you're a child, it may be a little more severe. It may have more involvement of different organs. So of all the people who develop lupus, 15 to 20% of them will start when they're a child. And when I say a child, it's usually as a young teenager. So the average age in our pediatric groups for it to start is somewhere around 12 and a half. And it is more females than males. I heard on this call a number of people who have a son who have lupus, and certainly we do still see lots of boys who have lupus, but the majority of our patients are girls or females. Okay, so that was a little bit about who gets lupus and why. But what are the signs and symptoms of lupus? So when we say signs and symptoms, I just want everyone else to be clear what we mean. A sign is something that I can see. So that's something that I can see from either across the room or when I examine you, or something that's in the blood tests. A symptom is what you feel when you tell me you have a headache or your joints hurt. So that's just the difference. And that's why we often lump these together, because together that's what's important, is the signs and the symptoms. Okay, so everyone knows about lupus and the skin. You saw that butterfly in the very beginning. And why do we use a butterfly for lupus? Well, this is why. So this is a young girl who has a butterfly rash. And that's the typical malar rash or butterfly rash that we see, but not everyone has that rash. And in fact, less than half of the people we see have that rash. Sometimes the rash can look pretty severe and can have these scales on it. Just rest assured that rash completely healed and she has no scars on her face. The rash can look like this sometimes, where it doesn't cross the nose, right? So it's not really a butterfly. It's like the wings of the butterfly, but it doesn't come across the nose. But you also see in this girl, the rash can be on the chin, and sometimes on the chin and on the neck as well. Or the rash can be on the ears, can affect any part of the ear. And then there's many, many other different kinds of rashes that we see. I just put up a few of the malar rash because that's the most common rash. But we also see this kind of rash where it's a little more, there's different areas and they don't all connect. We call this a discoid rash, but you know what we call it doesn't really matter. It's a rash that we see in lupus. Some people have a rash like this where it can be all over the body. And so, you know, rest assured, there are many, many different kinds of rashes. And that's why we always ask when you come to clinic. And you may say, you know, I have a rash on my finger. What's that got to do with my face? Well, it may still be a lupus rash. So it's important to always show us those rashes. I'm not going to show you all the other rashes because I don't want to, you know, make everyone grossed out or anything like that. Then we use this term mucocutaneous. Now I actually sat and stared at this slide and I said, how else could I explain mucocutaneous? So mucocutaneous just means, muco means mouth or mucous membranes, your mouth, your nose, and other things. And cutaneous means skin. So we see other things that are sort of related to the skin or close to the skin. So one of these things that we ask all the time is, do you have any sores in your mouth? And the reason we ask that is because we often see sores in the mouth that look like this, and this doesn't actually hurt. So most people who have these sores don't actually know they have them until one of us points it out to them. You may get things on your fingers or your hands or your feet. These are what we call vasculitis or inflammation of blood vessels. And also this goes away, don't worry, it doesn't cause scars usually, and it's a sign of what's going on though, it's inflammation in the blood vessels. We may see this is called Raynaud's. Many of you have it, and many people who don't have lupus have Raynaud's. So just because you have Raynaud's doesn't mean you have lupus. So Raynaud's is when you go outside or you're exposed to cold for most of the time, sometimes when you're exposed to stress, and one or more of your fingers, could be your toes, it could be your nose, goes white. Sometimes it goes purple before it goes white. And then after some period of time, usually 10, 15 minutes, it gets warm again and it goes usually red or red, dark red, and sometimes quite hot. So Raynaud's is just a sign, and we see Raynaud's in many things. We see it in JDM, which was what Dr. Huber's talking about. It's another rheumatic disease. But again, we see it in lots of people who don't have any rheumatic disease. Another thing we see is hair falling out. So you can have thinning of the hair overall, or you could have a whole, like a bald spot. The fancy medical name for that is alopecia. Many people know what arthritis is. There are some people on this call, I know their child has juvenile arthritis. So the arthritis is just inflammation of a joint. So swelling of that joint or trouble moving that joint. And it can be any joint in lupus. So these two pictures are just showing you, this girl has swollen knees. You wouldn't know this is a girl, but I know who this is. This person's hand, they have swelling of the knuckles. So it really could be any joint in the body that can be swollen. And you can also get inflammation of the muscles, which can give you muscle pain and muscle swelling, some weakness, fatigue, and all of those symptoms. And these symptoms can look like juvenile arthritis, so JIA. They can also look like dermatomyositis, JDM, what Dr. Huber's talking about. So there's a lot of overlap between the different diseases that we see. What else? I know this is a litany. It's a long list of things. So I see David on my screen. I don't know if he's ready to interrupt me with a question, but whenever.
I have a question about kidney, but maybe when you're
Okay,
just
so let
talking
me
about
tell you a
this.
little bit about kidneys, and then you can ask me the question. So I like to put in pictures because people know what kidney beans are, right? Most of us eat chili of some sort. So the kidney, we have two kidneys. They're closer to the back than they are to the front of our stomach or abdomen. And they're about 10 centimeters long. So they're about this big, right? And our kidneys function to filter all the bad stuff in our body. And then they put out the urine, right? And the urine goes down into the bladder. And then you pass that urine. And so the kidneys, when they get inflamed in lupus, they often don't filter properly. And so what happens is you often lose the bad things. So you lose the proteins, the things that we want to hold on to, and you lose that in your urine. You may lose other things like some blood in the urine, but oftentimes you don't feel anything at all when you have inflammation in your kidneys from lupus, at least not early on. And so you may go to see your doctor and the doctor takes a urine test every time, and sometime they'll come in and the doctor may say, well, there's inflammation in your kidney and we need to do what's called a biopsy because we need to know more what's going on. Because we just look at the urine and all we see is protein, but we don't actually know what's going on in the kidney. So if we've ever spoken to you about doing a biopsy, this is what we see. They take a small sample of the kidney and they look under the microscope. Now, hopefully this just looks like a bunch of pink and purple to you, but to me, this is part of a kidney and this is showing inflammation in this kidney. We also do other fancy tests if you want to, I want to make some of you into scientists. This is called immunofluorescence. And what it is it's picking up those proteins right along the sort of reabsorption area in the kidney. And we can tell a lot by looking at it. In fact, we see all these different things that happen in the kidney. And then we come back to you and we say, well, you have class 2 nephritis, or you have class 4 nephritis, or you have class 5 nephritis. Now, hopefully we explain a little bit more than that. But what's important to know is that there are different kinds of inflammation in the kidney, different kinds of inflammation that can be caused by lupus, which is why we have to do that biopsy. Otherwise, we may give you too much medicine or too little medicine in order to fix them. I think that was all I had about kidneys in this section. So did you
Kidney question that came in. How common is it for kids to have kidney issues with lupus?
Right, that's a great question. So we used to say that 3/4 of the kids and teenagers that we saw with lupus will have kidney inflammation at some point. It's actually closer to about half now. And the reason it's closer to about half, or even less than half, is because we're picking up lupus a lot earlier. We're picking it up. We're more sensitive to it. And 20 years ago, only the sickest kids were the ones who we saw. Now it's we're finding that we're seeing milder lupus, which is great because it means we can intervene earlier and hopefully prevent the kidney disease from happening. And I guess the only other thing about that is that, again, it's the different ethnicities have a more or less higher or lower prevalence of having the kidney inflammation. So we know that if you are Black, you have a higher likelihood of having kidney inflammation. If you're white, you have a lower likelihood. And if you're from an Asian country, you're somewhere in the middle. So it seems like we use this ethnicity and we type people, and it's not that at all. We really know from looking at hundreds and hundreds of children from around the world what is more likely in your ethnic group, and that really helps us to be able to say to you, you know what, it's pretty unlikely that you're going to develop this, so we're okay to just sort of hang tight for another few months, versus me coming in and saying, your chance of having kidney inflammation is really high, so I think we can't ignore this. Okay.
Thank you.
No problem. What about the brain and the spinal cord? So this is your brain. This thing that looks like, it doesn't look like Swiss cheese. Swiss cheese has holes in it. I don't know what I call it. But most people by now have seen sort of what the brain looks like. And when we say the central nervous system or the nervous system, what we mean is the brain plus the spinal cord. And the spinal cord is the thing that allows you to, move your arms and move your legs and do everything. And in lupus, unfortunately, the brain and the spinal cord can be involved in many different ways. You may have headaches. You may have stress. You may have seizures. This is a picture of something called an EEG, which shows the brain waves. Don't ask me to read it because I can't. You may have low mood. You may feel depressed. You may have lots of stress and lots of pain, and lots of different things can go on there. Maybe you are seeing things that look funny. We call these distortions. You may also have hallucinations where you're seeing things that you know really aren't there, but you're still seeing them, or you're hearing things that you know really aren't there, but you're hearing them, or you're feeling things, and we call those hallucinations, and it can be part of lupus. You can have concentration problems. We have a lot of kids and teenagers who come in and say, you know, I'm just not doing as well in school as I was doing before. I have this fog, this brain fog going on. And all of that is lupus, or all of this can be lupus. So it's not to say that it all is lupus. So these are some of the things that you may be feeling. Maybe I'm feeling stress. Maybe I'm feeling panic or depression or anxiety. It may not be directly because there's lupus that's causing inflammation in your brain. It may be because you're trying to deal with lupus that brings some of this on as well. So one of my colleagues, Dr. Andrea Knight, who works at SickKids now, is really interested in mental health and lupus. And we know very little. You know, we're learning more and more and more. We're doing lots and lots of research, but there are so many reasons for mental health issues in kids and teenagers with lupus. You know, it's hard enough being a teenager, especially during this pandemic. It's really hard to be, you know, a teenager dealing with your everyday goings on, high school, all those things. But imagine putting a chronic illness on top of that. Imagine putting lupus that starts right as you're in the middle of your teenage years. So there's so many things that can be happening that sometimes it's really challenging to know, is this lupus that's causing inflammation that we need to treat with big bad medicines that I'm going to get to? Or is this, you know, I'm dealing with all of these different things. Maybe we can help to tease out one of them and help things along. So this picture is just showing that there are so many things that influence our mental health, whether or not you have a chronic illness, right? Pain, the medications you may be taking, the stress of having a chronic illness, the pandemic, I didn't put that one in here, your genetics, and then inflammation as well. That's part of lupus. And then the last part that's really important is that lupus can start in your teenage years, like I said, and our brains develop until we're 25. We all know this, right? Just because you're suddenly 18 doesn't mean, you know, if you have a teenager, if you have an 18-year-old, you know that when they're 18 doesn't mean they got it all, right? They're still doing teenage things. And it's really through young adulthood that brain keeps developing. So we're hitting it with lupus and potential inflammation right at that critical time period. So it's really important that we think about all the things that can be going on. This is just me saying the same thing in another way. So cognitive dysfunction, that's that brain fog, like I'm suddenly having trouble doing math. There may be many reasons why you're having trouble doing math. Some of it is because you're doing it virtually right now. Some of it is because maybe you just don't have like the greatest math teacher. Maybe you're not a math person in the first place. So now you have this stress of disease and everything else, and it makes math difficult. But lupus can also do that, right? So it's making it really hard. All right. I'm not trying to paint a really terrible, horrible picture, but I think it's important that you know all the different things that can be happening and why they happen and what we can do about it, because we can treat most of this and we can treat it really well. So let's talk about the blood.
We've got about 15 minutes before we go to questions.
Okay. Well, I'm just going to keep talking and we're going to keep the questions going while I'm talking.
Okay, then do you want me to jump in with a couple of questions then?
Yeah, sure.
Okay,
and so I can tell you if I can do those now or.
Yeah, we've got two that came into the chat. One was kidney related, which was, is there a way to protect the kidney?
Oh, it's a great question. The simple answer is no. The more complicated answer would be yes, when we think that you have lupus, we often will give you a medication called hydroxychloroquine or Plaquenil, And I'll talk a little bit about that in a few minutes. And that medication may help protect kidney disease from happening. And then once you have kidney disease, we like to be very aggressive, right? So we know that it can progress if we don't treat it aggressively. And so we often use a lot of treatment, and that's to protect the kidneys from failing and from going on to having, bad problems later on.
Thank you. Another question came in. Do the areas involvement change over time, or do they tend to stay the same?
Right, so it's another great question. And for anyone who sees me, I often will give a little talk about this. What we know is lupus can change all the time, but that said, the kidneys and the brain and spinal cord, the central nervous system, those are two major organ systems. We consider those the most important things to treat, because if we don't treat them well, bad things can happen. And those two major organ systems, we know how often they occur. And we know also that if it hasn't started by the end of the first year from the diagnosis of lupus, if you're a child, we know that about 60–75% will start in the first year. And about 95%, if you're going to have those problems, about 95% will happen within the first 2 years. So what I'm saying is if you had your diagnosis of lupus more than 2 years ago, and you never had a problem with your kidneys, and you never had a problem with your brain, your chance of that happening is very small. It's gone down a lot. So it's not that we hold our breath for those first 2 years, but we know that those first 2 years are really crucial. And then it sort of goes even down after 3 years further. We have had people who after 10 years, suddenly they have kidney disease, kidney inflammation, but it's very rare.
Thank you.
All right, so let's go back to the blood.
Back to the blood.
Sorry?
Back to the blood.
Yeah, back to the blood. Okay, so, you get your blood taken all the time. If you or your child has lupus, you know that we send you to the lab all the time, right? We get your blood tests, and, they put those tubes, and the tubes all look like red blood. And inside that blood, there's more than just red blood cells. So these are what the red blood cells look like. They look like these double concave things, and they're quite small. And this is like a normal person's blood. And in lupus, we can see anemia, or low numbers of red blood cells. And that can happen for a number of reasons. It's not just lupus. We know that white blood cells, these are white blood cells. Now, you could say they're not white, they're actually purple. That is true. White blood cells are not white, but these are the guys that fight all the infections and do all the good stuff. And when you have lupus, you may have low numbers of those white blood cells. Now, having the low numbers itself isn't necessarily a bad thing. Oftentimes, you may have low numbers of these white blood cells, but if you have an infection, your body makes more of them, and suddenly you have high numbers of these white blood cells. So it's not necessarily dangerous to have low numbers. Then there are things called platelets. And quite commonly in lupus, you may have low platelet numbers. And platelets are tiny. They're these tiny little things here. These are the red blood cells. I know they're purple or gray on your screen. And these are the platelets. So they're much smaller than the red blood cells. And the platelets are what make you stop bleeding. So if you cut yourself, your platelets suddenly clump and it stops the bleeding. So it's important to have enough platelets. You can develop blood clots when you have lupus. And there are some proteins in your body that may make it more likely for you to develop blood clots. There's a lot about blood clots in the news right now with the COVID and the vaccinations. It's a slightly different process that they're talking about. But having lupus, getting a COVID vaccine doesn't make you more likely to get a blood clot than someone who doesn't have lupus, just to put that out there. And then we do all sorts of things called antibody tests. And you've probably talked to your doctor, to your healthcare team about your antibody tests. They've probably told you about ANAs and double-stranded DNAs, or maybe they've never told you about these things, but these are proteins in your body that your immune system has made. And they give us a little bit of a picture of what kinds of involvement your lupus might have. If you have an antibody called a Rho antibody, you may be more likely to get rashes. if you have an antibody called a double-stranded DNA antibody, you may be more likely to develop kidney disease. But they're not 100%. So we don't go on that only as the only marker, but it may be something that we look at. All right, I think I'm close to the bad things that lupus does. So the heart and the lungs, just to remind everyone, inside your chest, you have 2 lungs, right? These 2 big bags that get bigger and smaller every time you take a breath. And you have your heart, which is obviously really important. And then you have all the blood vessels that go around that. So this is an X-ray of a normal person. And you can see that the lungs are nice and dark. They're almost black. And that means there's lots of good air in the lungs. And this is the heart right in the middle of your chest. And it looks really normal. When you have lupus, we can see fluid around the heart. We can also see fluid around the lungs. So you can probably appreciate that this white thing here in the middle doesn't look the same as this one here, right? So this nice normal heart here, and this heart is quite large. And what it's telling us is there's fluid around the heart in the bag that goes around the heart. And we call that pericarditis or pericardial effusion, and it can happen in lupus. And don't worry, you would have symptoms. So you're not at home with this. You don't have to worry that someone needs to do a chest X-ray on you. You would know that there's a problem. Okay, so enough of the bad looking things. Well, what treatments are available for lupus? I've told you about all the terrible things that could happen. I always like this picture. Is this the sun coming up? Is this the sun coming down? It's probably completely photoshopped, like made up picture, but I still like it. And to me, what it is there are things on the horizon, that it's not all dark, terrible news right now, that there are lots of things in the pipeline. There are lots of things that are going to change in the next 5, 10, 15 years that are going to make lupus better. Okay, it's never, you know, something you want to know about, but we have lots of treatments, and it's a lot better than it was 20 years ago, and it's just going to get better. This is a little bit, David asked one question a little bit about this earlier, but this is just how I think of lupus. If we think of this bottom line as having no disease or remission, people get scared when I say remission. It's not like remission. It's not like cancer. This is not cancer, right? When you have lupus, our goal is to be on as little medicine as possible and to have few or no symptoms with as little medicine as possible. I call that remission. Flare is like when things are really active. You have swollen joints, you have terrible rash on your face, your kidneys are inflamed, and you've got protein in your urine. There's all different ways to have flare, but lupus is something that has flares and has remission. Maybe you have a little flare, maybe you're feeling achy and really not great for a few weeks or a few days. Maybe you have a big flare like this and you have kidney inflammation and it takes months to get it under control. Maybe you go into remission and you're in remission for 5 years or 10 years. I'm not trying to make things, you know, grim for you, but just because you're in remission for 5 or 10 years, the likelihood is pretty good that you're going to stay in remission, but there's still a chance that things are going to flare up. So the most important thing is to have a healthcare team, and to have a healthcare team that you like and trust. And even if you're only seeing them once a year when things are great, you still go once a year. Okay, so what do we do when lupus is really active? It's flaring. It's like your body's on fire. Most of you have probably seen this one, prednisone. Nobody likes prednisone, including me, but we still use a lot of it. So it's like we're putting out that forest fire with the prednisone. And that's what we're doing. We're really suppressing the immune system. We're turning that volume down. We're putting that fire out with the big hose. And so because of that, there's lots of side effects. So anyone who's ever been on prednisone knows there's lots and lots of side effects. I'm not going to go through all these side effects because any of you who have been on it, you've had all these, or at least some of them. It makes you gain weight. And that's the big thing for teenagers, especially. Nobody wants to gain weight from their medicine. Nobody wants to think they don't, you know, that the way that they look has changed. It is because of the prednisone, and it does get better, but it is still a side effect that we know of. And so there are lots of, you know, bad things, but sometimes we need to use prednisone, and we need to use it in really big doses because it can save your life, it can save your kidneys, it can save your heart, and all those other things that we worry about. Okay, so then we say, okay, you're not going to be on big doses of prednisone forever because nobody wants to, nobody could tolerate it, and it has terrible side effects, so we can't do that. So then we have to give you some other medicine to try to keep things under control. So one of those medicines is Plaquenil or hydroxychloroquine. And over the last, year and a half with the pandemic, Plaquenil was in the news for a little while because some people thought that it cured COVID. It doesn't cure COVID, but it is really, really great for lupus. Now, if you come in with a huge flare and you've got kidney inflammation and terrible things going on, Plaquenil is not going to make you better tomorrow. Plaquenil is something that once you're getting better, it helps to keep you better. Or if your symptoms are really mild, it helps to prevent new symptoms from happening. And what we know is that people who take Plaquenil, children and adults, if they stop it, even when they're doing really well, if they stop it, there's a chance that they're going to flare. So that's why when we talk about Plaquenil, we talk about it as something that's sort of a long-term medicine. But we also know that if you tolerate it, and 99% of people tolerate it just fine, it's safe. It's safe enough that if you're a female, you can get pregnant while you're taking it. You can take it during pregnancy. You can breastfeed while taking it. So it's like the safest drug that I have in my back pocket. What we tell people, though, is that you have to get an eye exam. That's this lovely picture. This is what the back of your eye looks like. So if we ever shine that really bright light into your eye, this is what we're looking at. We don't see all of it. This is what the eye doctor sees. I see like this little tiny part of it when I look. But we look at the blood vessels and we want to know that everything's going okay. So we tell you to go to the eye doctor once a year. And they do this fancy thing called an OCT. And this is what the OCT report looks like. And it tells us about your optic nerve. And 10, 20 years ago, we didn't have this fancy test. But now all the eye doctors have it, the optometrists and the ophthalmologists, and they can do it and they can pick up any changes from the Plaquenil that may be a side effect of the Plaquenil, and they can pick that up really early. So personally, I think things are safer now than they were 10 or 20 years ago.
We have a couple of medication questions
Sure.
that have come in. What happens when a patient reaches a cumulative maximum recommended lifetime dosage of Plaquenil?
Yeah, so there's a bit of a debate in the world, in the rheumatology world, and the debate is between the rheumatologists and the ophthalmologists, the eye doctors. So the eye doctors feel that there's this threshold dose, that we shouldn't go beyond this threshold dose because it's dangerous to the eyes. But the rheumatologist knows that, if we stay much, much, much low that threshold dose, we're not going to actually treat you well. And if we don't treat you well, we're going to need to use prednisone or some other nasty medicine that has even more side effects than Plaquenil. So we kind of go head to head. And what's emerged over the last couple of years is that if the dose of Plaquenil is too low, it doesn't give you a good response. And if we stop Plaquenil or we pull it back too soon, we're going to need to use something else. And so we try to avoid that. So personally, as rheumatologists, very few of us feel that there's this actual cumulative dose. What we know, though, is that the longer you're on it, so after 10 years, after 15 years, after 20 years, the risk of something happening in the eye does increase. It increases a small amount. If we keep the dose as low as possible, even after 15 or 20 years, the risk is still fairly low that anything is going to happen in the eyes.
Thank you. Two more medication questions. One is there a timeline for prednisone that it's safe to be on or I guess unsafe to be on?
Yeah, although it has terrible side effects, the shortest time possible is what we aim for. And that may be 2 weeks, it may be 2 months, it may be 2 years, it may be 5 years. We try to keep that period of time of high doses as short as possible. I can't give you a number because it really depends on what kinds of symptoms we're treating. And until we have better things that work really quickly, it's the best thing that can save lives and save organs.
There's a question about fatigue and medication. And one of the questions is fatigue a side effect of the medication, or can it be a side effect of medication?
Absolutely can be, is the short answer.
Okay.
Okay. The 3 medicines I've listed on this list, we still use them in lupus. They're not used as often as we used to use them, but they're still very good. And in particular, they're very good if you have arthritis or inflammation of your joints as the biggest symptom of lupus. That's about all I'm going to say about these here. This drug, mycophenolate mofetil, this medicine, I'd say we've increased using it over the last 20 years, and it's one of the most common medicines we use now. And it's really good for the kidney. It's pretty good for the brain disease. It's pretty good for all of the other symptoms that we see. But the downside is you have to take it twice a day, and it's really hard to take medications twice a day. This medicine we don't use very often, or these medicines, cyclosporin and tacrolimus or tacrolimus. We do use them sometimes if you have kidney problems, or if you have something called macrophage activation syndrome that I didn't talk about at all. So just so you're aware, it's, you know, these are medications that were used originally for people who had kidney transplants, sometimes liver transplants, and we use them in small doses, and they actually work really well when we add them into other medications. This medicine is sort of the big bad medicine called cyclophosphamide that we still use it. It's a medicine that's given in the IV, but we try not to use it unless we really have to. This is a medicine we use for life-threatening complications. We have lots of things on the horizon, newer medications, biologic medications. So in lupus, we're 10 or 15 years behind juvenile arthritis. So anyone who has juvenile arthritis knows that we have, sorry, we're just hearing, I'm supposed to be done in 5 minutes. All right, well, we'll do what we can. That's fine. Suffice it to say that there are lots of biologic medications that are being looked at in lupus, and there are lots on the horizon. There's one called rituximab that a lot of people have seen. Unfortunately, the big study failed, meaning it didn't show us the response that we wanted. We think because of the way that the study was done. But the second medicine on this list called obinutuzumab, it needs a good name because I can't say that. It's starting in some studies, and we're going to start a study in Canada in children with lupus. We're going to do that soon. And I'm hoping that it's going to be a good drug that's going to have a, you know, a specific use. There are other biologic medications. Some of you may have heard of this one called Benlysta or belimumab. And this is a study we also, a drug that we also studied in children with lupus in addition to adults. In Canada, it doesn't have, it's not licensed by Health Canada for use in children with lupus, but it is in the United States, and we have done the studies here in Canada. It's a Health Canada and company issue. But it's a drug that works fairly well. It's not, it doesn't work for everything. So I put a couple of these slides up because any of you who are listening know that if you have kidney problems or kidney disease or inflammation called nephritis, I don't give you one drug. I give you like 3 or 4 drugs all at the same time, and it's very overwhelming. And so I may give you 3 or 4 medications, but these are all the different medications I might be thinking about at the same time. So we have, you know, kids and teenagers who walk out of the clinic and they are like, I take 27 different pills during the day and I can't remember all of them. And we get it. And the goal is to, over time, decrease those pills so that you're not taking so many. Same thing for the brain. You may get, you know, a bunch of different medications. Same for the blood. If you have low platelets, you may get a bunch of different medications. Okay, so I want to spend the last 5 minutes on this because this is where, you know, I think we've come a long way, right? It used to be, we gave you medicine, go home. Don't worry, you know, don't think about it. But there are lots of other things you can do along with just the medicines that I give you. You can ask questions. What about my bones? How strong I am? What about COVID? We don't have time to talk about COVID. What about vaccines? You know, ask the questions, get your answers, and you talk to your whole healthcare team. It's not just a doctor. It better not be just a doctor as part of your healthcare team when you have lupus. You need sort of everyone. You may not need them all the time, but there's probably a nurse in your clinic. There's hopefully other contacts like a social worker if you really need one, a nutritionist or a dietitian, peers, and I think that's the goal of this group is peers, a physiotherapist or an occupational therapist, people at your school who can help, and then other doctors that you may need. You may need psychiatry, you may need an eye doctor, you may need a kidney doctor. You may need an adolescent medicine specialist, and different places have different kinds of clinics. So, at SickKids, we have the ability to have a lot of these doctors in the same clinic with us, but not everywhere is able to do that. Eat well. We can't tell you this enough, right? Look at all the colors on that plate. I wish my plate looked like that. Looks really yummy. I just don't cook that well. So, eat well. You're still going to eat junk food, but try to eat well, especially if you're taking prednisone. It makes you hungry, hungry, hungry. You want junk food all the time, but please try to get those fruits and vegetables in, and try to watch your salt, try to watch the bad things, all the things that we tell you all the time. Likewise, you need to exercise. You don't have to run a marathon. David likes to run marathons. You don't have to run a marathon. Walking is good. Especially right now. Get out of the house. Get away from your computer. Be honest. And you're like, why am I telling you this? Why shouldn't I be honest? Well, not everyone is honest. If you're not taking the medicines that we've given you, please tell us. Otherwise, what happens is I worry. I go in, I'm like, oh my goodness, everything is out of control. And look at all the medicines you're taking. Why is it out of control? If you say to me, well, you know what, Dr. Levy, I really hate this medicine, so I haven't been taking it for the last 2 months. I'm going to say, oh, okay, let's see what we can do about that. Let's see what we can do to make you healthier, and to, what medicine might work. How are you doing? It's really important. I think David needs to cut me off. I see that in his face. Okay.
I know you only have 3 slides left, so it's okay.
Okay. Have patience. Hang in there. I promise it will get better. Please, please, please tell us how you're feeling. This is just a slide that tells me all the things that we've already just talked about. You know what? It sucks to be a teenager and have lupus. I'm not going to say it any other way. There's no way around it. But if you work with us, we can try to make it as good as possible. I'm going to skip my summary slide because it just says everything I've already said. I'm going to say one day we hope to know no lupus in this world. We're not there yet, but there are lots of places to get help. Cassie and Friends being one of them. And then all this purple. And I don't know why purple was the color for lupus, but it is. Something to do with the butterfly, but most butterflies aren't purple. So there are lots of places. There's Lupus Ontario, Lupus Canada. I think there's Lupus BC. I don't think every province has a chapter though, and you can always go to one of the other chapters. There's Lupus Canada. If any of you are nearing the end of high school, Lupus Canada has scholarships every year. You should apply for them. There's the Lupus Foundation of America. Yes, it's American, it's in the US, but there's fantastic education on their website as well as the Lupus Initiative, which is through the American College of Rheumatology. So there's lots of information out there. Please find it. Please ask good questions. And I'm sorry I rushed through all that. I don't know if we have time for more questions, but I'm happy to take them offline if we can't answer them today.
Thanks, Deb. We've got just 1 minute before we are going to be sent back. So thank you. This was a great presentation. I think everybody got a lot out of it. I have some questions that are in here, and if you have, and which we'll send to you and then be able to get back. And if anybody else has questions that are left unanswered, please feel free to email through to Cassie and Friends, and we'll circle back to you with the answers. So thank you so much. We're going to all be sent back to the main room in less than a minute. So terrific having you all here. I'm sure everybody learned a lot, and I see in the notes coming in from the chat, if you're not looking at them, there's a lot of thank you and very well done. So I think everybody has taken a lot out of it. I know there's some questions about progress towards a cure and how that's going, and I know we won't have time to address that, but I think there's a general interest and you started to touch on it, and I think that everybody will be really interested to have a little follow-up, which we can share around maybe with sort of where medication is going and progress towards a cure. Obviously, that's what we want for all of our kids.
Yeah, and I'm happy. I'll answer all these other questions.
Perfect.
If you can just, send me.
I've captured them all, and we'll capture them. Oh, and then here's one more. I'll make sure I'm capturing this one too from Bruce.
Perfect. I would love to be put out of business, is what I tell everyone. I would love for there to be a cure and for me to not have to see anyone, because it means that we've done our job and that we've made life better. We're not there yet.
It's the dream of all of us, Deb. We want the best possible doctor that we hope we never ever see again.
Exactly. So sometimes I see people and I say, I hope you never have to see me again. And they look at me like, what? And I mean it in only the nicest way.
Yes, no, I agree. I think that's what we all want, and what we all are hoping for, that one day that's what comes for all of our kids, is a cure, or in the step in between, some medication that just puts them all into remission.
Yeah.
And
I'm just gonna answer this one question, because I see we have 85 seconds. So it says, what research is underway for non-medicinal treatments? I've heard of research on the microbiome and dietary triggers. Can you advise of what is being done? So in lupus, the microbiome is really interesting. I think we're not quite there compared to some other diseases that are more unified, like lupus, or like juvenile arthritis or inflammatory bowel disease. But I think there's definitely something there, because we know that certain countries, even though they should have large populations with lupus, they don't. And I don't think it's just because they're missing the population, that they're missing the children and the adults with lupus. I think there's something else. So it's probably something in the microbiome. And I think we'll learn more, in the next, years. So I think, I look forward to using less prednisone, no prednisone, and, having things look a lot better. I guess the only other thing to say about that is that we do have some kids who also have celiac disease. So there is something, and that's a, inflammation of the gut. And so there is something that overlaps there as another autoimmune disease.
And my daughter has both juvenile arthritis and celiac.